Hey everybody, this is Kevin and Rajinder and Nadia, and we're all here from RPhAlly, and I'm really excited to announce a partnership that has just formed, a co-leadership inside our women's health and support channel. So we have Rajinder starting things off. The support channel is really growing, which is absolutely wonderful. And this is really a building stage. As Rajinder and I have talked before, of just trying to get people in, get them to recognize that we do need more support. That's men's support, women's support, peer support, which we're trying to provide through RPhAlly. Nadia and I have had a couple conversations, and Sean, just on her background, her understanding, and kind of her perspectives, and felt like it would just be an absolutely fantastic kind of connection to bring her and Rajinder together for lots of reasons, and wanted to cover some of those today. So one of the things that we wanted to make sure that was kind of being covered inside of this live is when it comes to women's health, like women's health and support, Nadia and Rajinder, like what is it? Like what is women's health and support? And Nadia, I'll pass it to you first, since you're joining the crew, just to give us kind of an overall idea of women's health and support. Like what are folks expecting from it? What's typical of it? That kind of thought.
Yeah, sure. So thanks for having me. I'm very excited to be a part of this channel. So as far as women's health and support, so this is to support us women in the profession of pharmacy for our mental health, for physical health, and have any type of questions that you have regarding your health and wellness will be addressed here on this channel. There'll also be some questions that might be asked as far as that could be applied to patients also that you can share with your patients. So it will kind of work both ways for both you and for your patients also. So yeah, we're excited to be sharing some content on here regarding that.
Yeah, and that's an important differentiation, because you can have something that's just very personal, like it's just about you as an individual, but that's never the case when we're dealing with so many patients with all their different kind of needs, and all the information we learn we can pass off to them and they can benefit. So I love that call out. Rajinder, for you, when it comes to like women's health and support and what you've kind of already seen, through kind of the courses that you've taught and then becoming a leader inside of this space, like what are the things that you feel like are missing out there that you'd like to be able to deliver through this community?
Yeah, thank you, Kevin. Welcome, Nadia. I think it's amazing that, pharmacists being so accessible, that they should also kind of walk the talk. And that's what I've always talked about in my other programs. And, as pharmacists, we have to take care of our own health. We have, long hours, especially as women. Then we go home and then we have to be mom and caretaker to so many. Understanding all of those different roles that we play. That was why I was really drawn to being part of this support channel for women in pharmacy, so that they are able to have that holistic well-being for themselves, and then they can show up, holistically for their patients as well too. And whether it's through resources or adding more knowledge to specific areas of different women's health. I mean, you know, we stand all day, and oftentimes I've gotten my body over the years used to not even taking a break to go to the bathroom until the end of the day, just because that's what it is. And the implications of that on your health later on, we don't realize. And even simple things like that, taking the time to take that break for yourself, even if you're having a long shift and you have to step outside of the pharmacy for a few minutes just to catch some air, finding those little moments and so forth. And if you're pregnant and you're also working, what are the things that you should be aware of? We're exposed to so much in the pharmacy, again, standing on your feet, whether you're sitting down, swelling of the legs, and even coming back after postpartum, and the mental health issues that you could have. I think it's somehow we assume, just because we're healthcare professionals, that we have it all under control, and we're going to be invincible to these conditions, but we're not. And I think it's long overdue, the conversation that women pharmacists really need to start having. And again, we want to be a resource, a safe place for them to get answers and also have that support and just open conversation about what they're experiencing, and know that we are available to also help find solutions for them, with the resources we have.
Nadia, I'm gonna pivot things just slightly and throw you a fastball here, but I know you're good and you can handle it. So when I was in pharmacy school, I know that women in pharmacy was starting to overwhelm men in pharmacy. It was a kind of a push toward this is a profession where women can find some balance. That's still the case, Nadia? Like, do you still feel like the pharmacy world offers that? Do you feel like COVID has played kind of a role in the burnout elements overall? Like, where are your thoughts on, do you feel like pharmacy is still a spot for women to feel comfortable and ready to be professionals that they can feel fulfilled in?
I don't think there is any balance anymore with this profession. And that's the problem with all the increased states allowing pharmacists to vaccinate, which is that's a great honor for us to be able to do that. However, it's overwhelming when you don't have enough help. And then COVID on top of that caused a lot of burnout with, I know even with myself, with colleagues. There has been more that's opened up now with remote positions because of COVID. So there are other opportunities coming up for pharmacists. But as far as the, incorporating a 30-minute lunch break into a retail pharmacy, that doesn't cut it. And it's overwhelming for a lot of people. It takes a toll mentally and especially physically also. And I've seen a lot of women go through, many type of medical issues, miscarriages, problems conceiving. I mean, you name it, because you're placing so much stress on your body. So there's definitely no balance anymore.
Yeah, I mean, I can't think of a better time to be able to bring women together to be able to find, like, here's where we need the standards to be raised to, and to be able to take care of ourselves and recognize, like, it's a career. Like, it's a career and you can't let it take over your entire life and take away some joy. But speaking of it's a career, Rajinder, you and I have talked a lot about pharmacy technicians, and we know that pharmacy technicians kind of in the career pathway are part of RPhAlly, and we absolutely love having them there with us because they're our colleagues in the profession, and we have to be able to support each other. Same kind of question to you, Rajinder, when it comes to pharmacy technicians in the workplace. I know that at least for me, absolutely brilliant, two brilliant, incredible pharmacy technicians that I worked with, both women, both much smarter than me, and I was very grateful to them in my career. With both of them, it was in a hospital setting, and so I was able to be able to elevate their salaries, and push and advocate for them, which I was very grateful that the administrations allowed me to do. But inside of the retail setting, that can be different and difficult because of the reimbursement pathways that really limit us just in general. But same question, Rajinder, is being a pharmacy technician today, like, is that something that is a sustainable career path, do you feel like, for women?
Again, having been in pharmacy for almost 3 decades now, I've seen the security that pharmacy has given to a lot of women that, were able to come in and be grandfathered into the profession. Like, they started as clerks, and then they were trained, and then they were able to take, their certification, or even before, grandfathered where they didn't have to because they've worked, and be able to get a license because otherwise they weren't able to go on to secondary school. So I've always felt that it was a good entry point into healthcare for those that weren't able to go on for further schooling. But the grueling expectations and responsibility on these technicians, even as an owner, I know what they're going through. A lot of our technicians happen to also be single moms.
Yeah.
So they are the breadwinners of their family. And so it is hard to not be able to give them the compensation that they deserve because of the particular business model that we have. And it's getting harder and harder, especially if they have young children. We've been lucky that our pharmacy technicians showed up to work, regardless of what they had to do at home, with their kids being home and so forth. These positions aren't able to be remote, unfortunately. When you're in a retail setting, the work has to get done there. Maybe you could have some processing that, is done remotely, but for the most part, it's in person. You have to be there to kind of take care of the needs of the patients. And so I really find it's harder to see, you know, women going into the profession, even at the level of pharmacy technicians or pharmacists, because we're having a shortage of staffing right now. It's very hard to find staff that want to be in this kind of environment. It's not just, the responsibility and the long hours and the way the business model works, but also the microaggressions that you get from the other side, from clients and patients coming in from, if you're working in a bigger retail setting, it's a lot of times you don't have the autonomy to make decisions. Even if you did make a decision, that decision is overridden. And so day by day, all of that takes a toll on your mental health and physical health. And I think, again, why these conversations need to be had. We can't continue to further this profession without also including pharmacy technicians and the impact that it has on their well-being.
Excellent. No, I can't agree more. I think we have to be able to find some common ground elements to be able to help everybody kind of rise these common tides. And speaking of that, I guess, Nadia, when it comes to this channel, like, and what we really want to do in like 2023 and what we want to bring, to the pharmacy world and community, like what are some of your hopes? Like, what are some of the things that you want to be able to offer through this channel that'll be unique? And what kind of things should, women be looking forward to? I mean, and I'll be perfectly honest, I'm a man, but I will be joining. You guys are way too brilliant for me not to be listening in. And I feel like there's a lot of perspective I've gained, already from both of you, just in our conversations on me being a better husband and brother and et cetera, et cetera. So I think that's an important element. But concentrating on the women that'll be joining kind of the channel, what are your hopes and what are the things we're going to bring in 2023?
My hope is that we can bring content that most women are afraid to bring up or talk about or don't even know to talk about. For example, I posted an article with Pharmacy Times about increased miscarriages with women in the pharmacy profession and a whole study that was done. And there were some women talking about it. And I feel like, there are some areas where some women might not feel like they want to bring something like that up. But so, the uncomfortable conversations too, I'm hoping to cover, things about your sexual health too, so with my background and everything also. So, that's what my hope is that we provide content and can answer questions that someone you can't just get in a random Google search, or that will spin some really good conversations that other pharmacists can have with each other.
We'll touch on that one a little bit further, Nadia, because I don't want to distinguish that to a certain degree. I do. The sexual health component, it's just, it's such an important piece of our lives that, like, the ability to be intimate or thoughtful when our work environments and our life is so stressful and kind of pulling us down, like the importance of that, if you could just highlight it, inside of the women's channel, what you want to be able to bring there and why it's so important to concentrate on. Any kind of plug-in components, why women should recognize that this is a very important aspect of their life that could be impacted by some of these career components we're all connected by?
Yeah, absolutely. So part of what I do as a sexual health coach and therapist, sex therapist, is I talk to people, especially to women who, for example, you're working a long day in pharmacy, a long week, and you have low libido. That happens. That's normal. And not a lot of women talk about it or want to admit it. So things like that, your hormones, you're going through a lot of different changes at different stages in your life. So what your hormones are doing, what your levels are, have you had them checked? How are you feeling? What's your mood? Things like that, and it also affects libido. And the more you know about that also, the better you can help your patients that have those kinds of questions. It definitely works both ways, but for women, you're definitely getting more fatigued in the pharmacy, and and the burnout's high. So that's an important factor. Or if you're trying to conceive and having problems with that, or any type of stress-related medical condition that can be related to or be causing a decreased libido or just affecting your sexual health. So those are all, important things that not a lot of women, they kind of feel weird maybe talking about, but it's part of life, and and it's important. So
No, I'm so glad that you can make that an approachable kind of conversation for women. I feel like it really needs to be in that safe space, like you said, that folks can feel comfortable talking about those things coming along the line. And interesting, I think for me as like a young pharmacist, like having older women talk to me about some of those things they're going through,
mhm.
eye-opening that I had no idea that those are some of the issues they were going through. And difficult to recognize that it's undervalued in our academic setting, that we don't talk about it enough on how to address those things and deal with them. So I think, like you said, from both you as an individual and as a practitioner or a clinician, like it's such important value you're bringing. So thank you, Nadia, for that. And then Rajinder, same kind of question to you. Like, what are your kind of hopes in 2023 and the things that you'd really like to see come out of this community to be able to help women?
Yeah, first and foremost, I'm just hoping that it's conversations that we have. This is, a support channel. So we want a back and forth conversation of the members that join. It's not just us putting content to inspire, but we want that engagement. And that's where I really want to take it to the next level, where we start the conversations in these forums and then bring it to live sessions, in-person events. I mean, that's my sweet spot. I want 2023 to be where, we have live events where women, pharmacists can get together and really learn to invest in themselves personally. So then it trickles into, again, all of their different roles in their profession and in their personal lives as well, too. I think we have sometimes think that, you've spent time in school and gotten doctorates and so forth, that you're done with getting education. And then we go into field, into regardless of what industry you go into, we are almost put into a box, and this is like what we need to do. These are our expectations, and it becomes robotic in a way, and I think that there is so much more that women in pharmacy can do and are capable of. I think they just need to be like re-energized to think bigger of all the possibilities. And that's what my goal is to, one, be available where there's that safe space for them to have the support, like Nadia said, physically, so that your your physical health as well. And then you go into your mental health so that you're able to take care of those aspects of it, not to feel that you're alone. And again, this channel is there for that support. And then also to infuse, your spiritual health, so that you take it to that we're, collectively a community. What we're doing, in our profession, we're, in it together, and that, there isn't one industry that doesn't need the other aspect of another industry. And so it's just creating that network of support for one another.
I love it. Lots more to come from both Nadia and Rajinder. Thank you both for joining me today. Thank you both for taking on leadership roles inside of our women's support and health channel. If you want to join and be able to have this conversation, as Rajinder phrased it, and have the uncomfortable made more comfortable, as Nadia had pointed out, please join the Women's Support Channel. It is there for you. It is free and accessible. Go to RPhAlly.com, register there, and feel free to join and have these two wonderful thought leaders as kind of your guides to help you through. Thank you both very much. If I don't see you, have a wonderful holiday, and hopefully we'll be talking to you very soon.
Thank you.
Thank
Happy holidays.
you as well.
All right. Bye, everybody.
Bye.